Well, so good to have you here on WKYT. The U.S. Department of Health and Human Services says about 15% of American adults have some trouble hearing.
And as we wrap up Audiology Awareness Month, we take a look at what can help. Vanessa Ewert is here to tell us more about that. Thank you very much for coming in.
Thanks for having me.
Well, you know, I guess it should be obvious, but why is it important that from time to time people have their hearing checked?
So we recommend it at all ages, basically because a baseline hearing test is always good to have, just like getting our eyes checked every year. So it's good to get our hearing checked too. Also, if you are noticing difficulty, untreated hearing loss can lead to some early dementia, isolation, depression, and some other health risks as well.
Do you find a lot of people who come in and then find out that they have hearing loss are really not even aware of it?
Sometimes we do. We have people come in, they want to prove their family wrong or something like that. They're like, I just want to get my hearing tested just to show them that, no, I don't really have, a hearing loss. But we do sometimes diagnose people, and we work through that process with them. It's just like any other condition. There's a whole process of kind of working through it, and we're there to do that with the patient.
There are always some advances coming along, and you stay on top of those. What different kinds of technology are available to help people with their hearing?
Yeah, so, of course there are hearing aids to help people, but there's also other assistive listening devices, some that are great for before you even get hearing aids, some are used in conjunction with your hearing aids, so such as like an amplified telephone to help hearing over the phone. They work with iPhones now and are iPhone compatible. You also have devices that can stream straight from the TV to the hearing aids. Hearing aids themselves have changed so much. These are just kind of some examples of them now.
They're so tiny.
Yeah, so even UK blue. So
in the spirit, that's
yes,
right.
Exactly.
What's the experience like if people show up at the Bluegrass Hearing Clinic or some other clinicians to be checked out? All of our doctors of audiology, we work through kind of this whole 4-step process with the patient where we identify their goals, what their hearing needs are, because the better we understand what your goals are, the better we can treat and come up with a better treatment solution and plan moving forward, just to work through the whole process of hearing loss and getting that quality of life back.
And a lot of people may think that this is, I don't have to think about this. This is something I'll think about when I'm 70 or 80. Hearing loss and hearing problems are for all ages.
Absolutely. Yeah, we see children all the way up to, I think my oldest patient's about 104.
Wow.
So, and everybody in between. So it's not just the aging population. It doesn't make you old or anything like that. It's just something that needs to be taken care of when you do notice that you're having some difficulty.
Well, thanks for coming in and telling us about it and calling attention during this Audiology Awareness Month of October. But it sounds like we need to be aware all the time.
Yes.
Yeah.
So,
Appreciate you coming.